Hey guys, my name is Mavi, and I've spent the last 14 years in the plastic surgery and beauty industry, working alongside top board certified plastic surgeons.
Now I'm an independent patient coordinator who doesn't work for any surgeon. This means I have unbiased reviews for hundreds of doctors, and I can help you achieve the look of your dreams, whether that's a supernatural or a video vixen. I use my professional and personal plastic surgery experience to help you look and feel your best.
Join in on the fun as I talk to plastic surgery experts, friends, and real life patients about all things plastic surgery. Should be fun. Hey guys, do I have the show for you today? I am super excited to talk about a very important topic that I have been seeing all over the internet, all over the Facebook groups, and especially in my DMs. And I couldn't think of a better guest to bring on than Dr. Amir Arsalan out of DC/North Virginia. And he's going to tell us everything that we need to know about fat grafting to the breast. Thank you for being on the show, Dr. Arsalan.
Thank you for having me, Mavi. Very excited to chat about this.
Yeah. So you guys, right before we got on, he told me he saw 3 consultations for fat grafting to the breast. So this is a very hot topic, and I want you, on the show, we like to get to know like the ins and outs, the complexities, the what to know of different procedures, and fat grafting being so popular and gaining more popularity. I really wanted to bring on an expert that can help us navigate through the different questions, the different doubts, and I'm so excited to have you on.
Like I said, very excited, Mavi. Thank you for having me on. This is a great topic. We've noticed a huge uptake in patient inquiries for just this specific surgery. So fat grafting to the breasts, what is it? I think when I'm thinking about why we've had all these inquiries, I think a couple of different reasons. First and foremost, for our listeners out there, there's been a little bit of fear of breast implants. So the term BII, breast implant illness, has been a hot topic in the past few years. For those who don't know what that is, basically some women are having some symptoms that can be vague in nature, things like fatigue, discomfort, pain, and a small subset of these women feel a lot better when their implants are removed. So things like that, along with the overall trend of moving towards more natural aesthetics, have, I think, intrigued a lot of our patients to inquire about, well, what are the alternatives to breast implants? How can we volumize or augment or enhance our breasts through natural means? So I think that's why it's been a kind of a trending topic recently.
Absolutely.
So simply put, breast augmentation with fat grafting involves some liposuction, which is a procedure where we remove some fat from other parts of the body, like the abdomen, the flanks, lower back, arms too. You'd be actually very surprised to see how much fat we could remove from someone's arms. And then processing that in a very careful manner, and then meticulously injecting that into the breasts for volume gain. So that's kind of what the procedure entails.
So one of the things that I want to bring up to my girls, because a lot of times they're planning their surgery journey, right? And they will think, okay, well, I don't want to do it now, but maybe I'll do it in the future. And they'll still go forward with maybe some body surgery, maybe a breast lift. Remember, you guys, after you get that liposuction, that fat is going in the trash. So if you don't use it, you lose it. It's gone. We can't bring it back.
Yeah, exactly. This is a great adjunct. I mean, anytime you're contemplating liposuction in general, I try to offer my patients options. Well, are there any other areas that you wish to address? So, and it doesn't have to be anything exaggerated, Mavi. I personally prefer more of a natural aesthetic, and that's been the trend in the past year, moving towards that. And so areas that you can fat graft could be the face, the breast, the buttocks, hip dips, hands. Yeah, I just did two fat grafting of the hand cases last week. A lot of different application, and it's a beautiful technique. Why waste all that precious fat? This is the time to do it.
Exactly. So I want to talk a little bit about the origins of fat grafting because I know that there's a subset of surgeons out there who do not agree with putting fat in the breast and
Mhm.
they're kind of like anti fat grafting. So I want to clear some of the confusion for our listeners about why are some surgeons like pro and they do fat grafting to the breast, and why is there some surgeons who don't think it's a good idea?
Great question. Yeah, so fat grafting actually dates back all the way to like the late 1800s. So that's kind of hard to believe, but back then it was largely experimental. And then roughly in the 80s or so, it started gaining a little bit of popularity for other things, mostly for reconstruction. So, someone who's had breast cancer, they've had mastectomies with all their breast tissue removed. Fat grafting was used not as a way to recreate the breasts, but to just really bulk up the soft tissue envelope. So, you would have kind of a thin soft tissue envelope in those situations. And then the fat grafting there is there to kind of just fill in some mild contour irregularities and things like that. And even in my own personal training, I train in Southern California where we do a lot of plastic surgery. A lot of my faculty members and mentors, they weren't really advocating or pushing for fat grafting to the breast. So it's become kind of like a newer thing. And so with that in mind, techniques have also changed and evolved as well. So I think part of the reason why there are surgeons who are probably a little more considerate, or not, I wouldn't say fearful, but just
Hesitant.
yeah, a little hesitant to move forward with that is because as it stands today, breast implant is still the gold standard way of augmenting the breasts. And we'll talk about pros and cons later, I'm sure, but that's been like kind of like the history of fat grafting. And then, yeah, so we're kind of like thinking about how can we improve these techniques. So there's been a lot of innovation, and we're very excited.
I love it. One of my questions I forgot to mention is
Mhm.
I want to know the secret sauce of how to make that fat stick in the breast. But we can get to that. We can get
Yeah,
to that a little later.
it's a good question.
So I always like to inform my listeners when they're making their decisions of what procedures to choose, what the pros and cons are for whatever they're choosing. So I want to go into a little bit about what the pros and cons are for breast implants and what the pros and cons are for fat grafting.
Yeah, perfect. So basically, let's start with breast implants first. So, breast implant is a very predictable way of augmenting the breast. You put in X amount of cc's, that's what you're going to get, right? So, that's a major benefit, the predictability. The downside is obviously the maintenance. So, the FDA recommends removing or exchanging these implants every 10 to 15 years. Sometimes you can push the envelope a little bit and wait until about 20 years, but you got to keep in mind these are not perfect devices. They're prone to wear and tear. So eventually you're going to probably develop implant rupture, things like capsular contracture, which is where the scar tissue around the implant hardens, and things like that. So those are some of the downsides. Another pro for implant is that it's a shorter surgery than fat grafting. So just kind of keep that in mind. It could be considerably shorter on average. Implant-based breast augmentation can take about an hour to an hour and a half. And obviously that changes if you're doing other things like a breast lift, etc. So that's breast implant surgery. Now, fat grafting, here are the cons. The biggest one is unpredictability. Despite having had several decades of experience with fat grafting, we still haven't figured out a way to really enhance the viability of the fat. But the good news is that there are a lot of surgeons doing studies out there. Examples of this include using PRP, which has been also a hot topic, platelet-rich plasma. You take your own blood, spin it down, and use that to kind of boost or augment the viability of the fat. So that's one approach. And then, industry is also helping out. Sientra's come up with this new product that is used to clean the fat, and there's some good studies out there as well with that. So back to my earlier point, Mavi, fat graft retention is kind of unpredictable. I tell my patients it could be anywhere from 40 to 60% long term. So that's after a year. So that's one consideration. Pros, well, it requires a little bit of liposuction. So maybe that's not the worst thing in the world. You could think about liposuctioning the abdomen, the flanks, 360 lipo, arms, like we talked about earlier. So you're kind of getting, kind of killing two birds with one stone, essentially. So that's a benefit. And then finally, the other benefit, obviously, is it's natural. You're using your own tissue, your own fat to really help augment your breasts. So I would say, on a surface level, those are kind of the pros and cons.
One of the things I want to point out is fat grafting to the breast is going to act just like your normal fat. So if you lose weight, your fat in your breast will also reduce. If you gain weight, your fat in your breast will also gain weight. So that's something that when you have implants, you don't have that. The implant's going to be the same size no matter if you gain weight or lose weight. And I want to make sure that I point that out to my girls, because if you do gain weight, you're going to gain weight in your breast as well. And if you lose it, if you're at the gym and you're trying to lose it, you could lose some of that fat in your breast. And I've talked about this on my Instagram, but I would love to talk about it now, about when you do lose weight, how it actually works with the fat cells. And it's not like the fat cell is completely gone forever, but it's just the fat cell itself is getting smaller. Tell us a little bit about that.
Absolutely. Very important that our listeners understand this. I tell my patients all the time that obviously with weight fluctuations, your body will respond accordingly. So the way it works is basically we're born with a certain amount of fat cells. So just for simple math, let's say we have 1,000 fat cells. The way liposuction works is we're basically removing the fat from one part of the body and then using a certain percentage of that. We're not using all of it, but we're transplanting it essentially. So if you gain weight, those fat cells don't multiply, they just get larger. And the converse is also true. If you're losing weight, then those fat cells will shrink. So the beauty of fat grafting is basically you're just taking one fat from one part of your body and moving it to another part of your body. So those fat cells will respond the same exact way. And so that actually kind of brings up a very important point: nutrition. So nutrition is so critical whenever you're contemplating any sort of surgery, because your body's going to be in a hypermetabolic state. So you're going to be burning through energy reserves a lot more fast, or a lot more quickly. So I actually have a handout that I hand to my patients with dietary recommendations. I want them to hit certain macro goals: high protein, low sodium. Definitely don't be shy about carbs or calories, but yeah, super important that patients adhere to that kind of diet, because you want the fat cells to get all the nutrients.
Absolutely. We talked about this in a previous episode just recently about how sometimes when patients are past that initial period where they don't feel that great and they're not their best selves, but once they hit past that hump and they start seeing the results, and then they're like, okay, I don't want to mess them up, and they lower their calorie intake and they try to hit the gym and to maintain these results, but sometimes that can make you lose some of that fat. So I think there's a common saying online called feed the fat. This is exactly what we're talking about.
Totally. Yeah. I'm a big proponent of it. Honestly, when I first started doing these surgeries, I didn't really think about those aspects of things, but it really does make a difference.
Absolutely. So one of the things that I also like to do on the show is talk about the things that patients could be reading online in the Facebook groups about don't do it because this is going to happen to you, and don't do it because this happened to me. And a couple of those things are oil cysts from fat grafting, which isn't specific just to breast fat grafting. It can happen to fat grafting anywhere that you have it done.
Yeah, totally. It's always important to educate our patients on some of the risks, right? So these are real things. Oil cysts are basically areas of fat necrosis that have kind of liquefied into oil. And then another risk is actually calcifications, which is when sometimes those oil cysts can harden and calcify. And so what does that mean for the patient? Well, you can have some palpability of some of those hard nodules of the calcifications. That could be a little disconcerting for our patients. Another thing is it can affect mammography. Fortunately, though, it's super safe to inject fat into these areas. Um, and radiologists are trained to differentiate between some of those findings, like the oil cysts or microcalcifications that happen with fat grafting versus more concerning things like breast cancer. So um, uh, there are things that can be done to help treat those issues, and there are ways to screen for them as well. So technology has become very sophisticated in helping us diagnose those issues.
Something that I've seen with, with my one-on-one coaching, with my consulting, I help patients through their whole process. And it doesn't matter what surgeon they go to or who they go to. So I get to see a lot of protocols from different surgeons and pre and post instructions. And one of those things that I see quite often is when patients are going to have any type of breast procedure, the surgeons will have them do a mammogram before they have the surgery.
Yeah. Definitely. I'm a strong believer in that. I think safety first. This is all elective surgery. We have to really like keep the patient's best interest in mind. And so I require all my patients to get some sort of imaging that's within the past year. It could be high definition ultrasound, mammogram, or an MRI. Mammograms are usually better, but yeah, at a baseline. And that way, it gives the radiologist a chance to determine, okay, this is the baseline. And any sort of pre-existing things that they see are obvious in that baseline mammogram. And then they can continue the normal screening surveillance as they typically would, which most women get it at age 40, and then they, carry that through on an annual or biannual basis. So yeah, imaging is super important.
So if you're listening and you're going to have a breast procedure and your surgeon didn't require it, but you might want to do it on your own just for your own peace of mind, have a baseline uh, mammogram before you go through with your procedure. Even if your
Yeah.
surgeon doesn't require it, you could ask them, "Hey, I want to do this. Are you okay with it? Could you give me an order for it?" Or there's actually places where you don't even need an order. You just walk in and pay and they do it for you.
Yeah, safety first all the time. I think you're going to really find it to be useful. And I think most surgeons kind of get it too. If a patient comes in and they request a certain thing that maybe wasn't originally part of my protocol, I kind of reevaluate that. I think, okay, well, they're bringing up a really good point. It seems pretty logical for me to just do this. So then, giving that feedback to your surgeon might also be helpful. I'm not an arrogant person. I think things can always be better. And so I encourage that kind of honest feedback from my own patients.
Absolutely. So, one of the things I also want to talk about is breast massage. So, breast massage, actually, we weren't going to talk about this, but breast massage after implants and breast massage after fat grafting.
Ooh, okay. Yeah, that can be a little bit of a controversial topic. So here's what I recommend for my patients who are getting implant-based breast augmentation. There was an idea in like the 90s and early 2000s that maybe massaging the breasts could help with capsular contracture. And then some later studies kind of debunked those initial claims or thoughts. I don't routinely tell my patients to massage their implants. I have no concern or issue with them massaging their implants. So if they came to me and they wanted to do it, sure, I would allow that at 2 weeks. It's not routinely part of my protocol. But then I have some partners who do that. And that's kind of the art of medicine, right? Everyone's got kind of a different way of doing things. And yeah, so I'm okay with it. It's just not part of my routine protocol. Now, where it gets tricky is with fat grafting. Um, I actually am not a big fan of breast massage with fat grafting. I like lymphatic massage, and I think that's super important and helpful. But with fat grafting, I tell my patients offload the pressure. So I don't want any like manipulation or even if it's gentle in the first 2 weeks. After that, I think it's safe to do. But in the first 2 weeks, I don't like any pressure on the breasts or any areas that we're fat grafting. So that's kind of what I like. But I do like lymphatic massage.
When do you allow them to have their first lymphatic massage?
Yeah, great question. So I usually start lymphatic massage within 72 hours for the first one, and depends on the surgery too.
Right.
Some patients are a little fearful of that first lymphatic massage. They think that it might be kind of a painful endeavor. And usually the massage therapists that we work with are very good. They're seasoned. So it's not a really super painful procedure. And after that first session, a lot of patients report feeling so much better. So my protocol is within 72 hours for the first massage, and then I continue weekly. And then generally, most patients do about 8 to 12 sessions, possibly more depending on what needs to be done. I think lymphatic massage is great for various reasons. It really helps restore that lymphatic circulation, kind of flush out some of the toxins, get some of that swelling or edema down under control. And then, it really helps with preventing and decreasing fibrosis, which is early scar tissue formation. So, huge fan of it.
You know what? I didn't mention this before of when we were going to start recording, but I just thought about it now because I had one of my clients talk to me about this just yesterday. She said, "When can my husband play with
Oh,
the new toy?" And
yeah,
more importantly, she said, "When can nipple to mouth happen again?" And I've actually talked about it on previous episodes with surgeons who are like, "Stay away, please." No nipple to mouth for like 3 months, 6 months, because they've seen things go wrong. So I want to talk about it specifically with fat grafting to the breast because we've talked about it with implants. So
right.
what about for fat grafting?
Yeah, that's a great question. I just want to go back to implants for a second, just because I think that way we can, compare the two, right? That's important for our listeners to understand. So everyone's having sex. It's not a taboo concept. Patients are a little shy talking about it, but you got to have open and honest communication with your surgeons because everyone does it.
Yeah.
So that being said, I think it takes about 8 weeks of healing before any sort of breast play can occur. I mean, that doesn't mean that you have to be celibate for 8 weeks, but I want to preserve the longevity of your results. Our patients have spent a lot of time, resources, and recovery time just trying to get the surgery done, and I want the best results possible. So I think 8 weeks is a very safe timeline for implants. Fat grafting, I think we can afford to be a little bit more relaxed because there's no risk of implant malposition because there's no implant. Um, I do worry about the long-term viability, but I would say after about 3 to 4 weeks, you should be good to go. Now things may change based on, based on more experience with that sort of thing. But as it stands right now, I think that sort of number makes sense in my head.
Okay. So now y'all know at least 3 to 4 weeks after fat grafting.
Yeah, but always consult with your surgeon first
Yes, of
before you do
course.
anything. Don't take my timeline and adapt it to your own recovery.
No. Always ask your surgeon. Do not do anything that your surgeon has not given you permission to do.
Yeah, I don't want any phone calls from some angry surgeons. Hey, Dr. Arslan, why are you telling my patients X, Y, and Z?
So, one of the questions that I wanted to cover was how long after fat grafting can a patient expect for their, like, this is the final result, this is what it's going to look like? We usually talk about it for fat grafting to the butt for BBLs, but I want to talk on how long before they're like, okay, this is the fat that took, this is what I can expect.
Yeah, so I think the principles are going to be pretty similar to BBL surgery. There's going to be a honeymoon phase. So you're going to absolutely love your results. And that usually happens at about 3 weeks to probably about 2 months. And then you start to kind of see a little bit of decrease in volume. But, I think what a lot of surgeons, and myself included, what we're doing is we're overcorrecting a little bit because we're anticipating that volume loss. So in the initial stages, you're going to absolutely be in love with your results. And then that fat will start to slowly go down. The swelling will start to go down as well, along with that. But 1 year is kind of the really long term. When I tell my patients, what you see is what you get. Provided that you're not having any weight fluctuations, obviously, because that will impact those results too. Someone who's lost 20, 30 pounds, you're going to notice that.
Mm-hmm. Absolutely. So before I let you go, Dr. Arsalan, I want you to tell us, what are you excited about in 2025? What's new? What's coming out that we don't know about? What are you excited about?
Yeah, so um, a lot of people are kind of predicting what are going to be the trends for 2025, and I don't think there's going to be a huge discrepancy what we saw from 2024 numbers and 2023 numbers. And just to kind of hit on that a little bit, the American Society of Plastic Surgeons always releases these statistics, and so in 2023, the top five procedures were actually pretty much all breast and body procedures. Number one was liposuction. Number two, breast augmentation. Number three was, I think, tummy tuck. And then there was, I think, a blepharoplasty or upper lid lift as well. But I think specifically for 2025, there is this new trend, and I try to avoid trends, but it's important to talk about it. Smaller natural breasts. And I'm seeing that with my own patients. And that's actually kind of also feeling the whole interest in fat grafting. So I think smaller, more natural appearing breasts. There is a new implant that just got FDA approved last year called Motiva implants. It's not new by any means. It's been around for 10 plus years globally, but we just got it in the US. I've had some pretty good results so far with that. So I think that kind of ties in with the natural thing. And then I don't think liposuction is ever going to go away. So really, that's kind of my prediction for 2025.
I agree. I actually have not seen a downtick on liposuction, mommy makeover type results, which I heard that there's some controversy just on the word mommy makeover, but what we mean is multiple procedures done, lipo, tummy tuck, breast, whatever breast procedure done at the same time. So,
Yeah, it's a great combination. It just makes sense. You're combining multiple procedures, one recovery. It's usually a little bit more cost effective as well, and you're treating the entire package.
so before I let you go, I have one more question.
Okay,
And
all right.
whoever's listening that's keeping the tally, I always ask my plastic surgeons, um, are you team drains or no drains for your tummy tucks?
Ooh, that is
And
controversial, Mavi.
so I'll tell you what our statistics are so far.
Okay.
Out of maybe like 50 or 60 surgeons that we've had on the show, there's been maybe two that are no drains.
Yeah, I'm definitely hashtag Team Drain as it stands. So all my tummy tucks get drains. I have not shied away from it, and I also do external compression, which most of us do anyway as well.
Yeah, it's a funny topic because I think a lot of surgeons are receiving inquiries for do you use drains? Do you not use drains? And there's some surgeons out there who really emphasize that you don't have to use drains, but I'm team drains all the way.
Yeah, I think it goes back to safety. The surgeons who do drainless tummy tucks, I think that's a reasonable approach as well. It's just in my hands, I prefer to use drains. It makes me feel better. I sleep better at night, and it just makes sense the way that I do things. But to each their own. I wouldn't say. Shy away from surgeons who offer drainless tummy tucks. I think that's reasonable if they think they can offer similar results in their hands. But my personal preference is to use drains. So I'm glad we agree.
Team drains. So who's ever keeping tally, there's another one for team drains.
Perfect.
With that, Dr. Arsalan, if my girls want to come see you, how can they find you?
Great question. I would say find me on Instagram. It's Arsalan Plastics. We can link that on the post as well. And then from there on out, we have specific contact information. So if you're in the DC area, you're interested in breast surgery or body surgery, come see us.
Go look at his page, you guys. His tummy tuck results are beautiful.
Thank you. Thank you for the kind words. Appreciate it.
And with that, I'll see you guys next week.
So if you're listening to this episode and you're listening to the Big Butts No Lies podcast, you might be on your surgery journey. And if you are, and you don't know what to do, you don't know where to start, you've come to the right place. I am so excited to do one-on-ones with you guys. I've realized as I do them more and more just how valuable they are to you, not only because you get my expert opinion, I get to guide you towards plastic surgeons that we know are going to do a good job and keep you safe. Besides all that, I get to talk to you about things that might not even be on your radar, things that you don't even know are possible. But since we get so in depth with our conversations and I really get to know what your dreams are and what you're really looking for with your body, I can tailor my recommendations to the surgeons that I know can help you achieve that. And taking the guesswork out of who to go to is invaluable. So schedule your one-on-one phone call with me. You can go to my website, go to the quick links, submit your information, let me get to know you, let me see how can we help you. You can get your own team. You guys, I have been working so hard behind the scenes to come up with a perfect way for you to have your plastic surgery and not only come out with beautiful incisions, but also feeling beautiful on the inside. So book your call with me and take the guesswork out of your plastic surgery journey. And don't forget, new episodes every Monday. I'll see you then.